Did you know there are 4 goals of restorative home care programs? Restorative care or rehabilitation involves helping clients move from illness, disability, and dependence toward health, ability, and independence. Goals of a restorative or rehabilitative program can include the following: to help a client regain abilities or recover from illness, to develop and promote a client's independence, to allow a client to feel control in his or her life, and to help a client accept or adapt to limitations of a disability. Rehabilitation will be a goal of care for many of your clients, particularly those who have suffered a stroke, accident, trauma, or other disabling condition. Because you will spend many hours in the home with your clients, you can play a critical role in helping clients recover and regain their independence. Rehabilitation is one of the great joys of working as a caregiver. You should enjoy seeing clients progress toward independence or recovery and take pride in the contributions you make to improving their health. The home care rehabilitation model. Just as with any client, when you work with clients who need restorative care, you will be working as part of a team of caregivers. Some different members of the team and their roles may include physicians, nurses, therapists, social workers, counselors, and you, the CCA. You as CCA will be in the home carrying out the instructions of the other members of the team, assisting in achieving the client goals and observing and reporting the client's progress. Observing and reporting a client's progress in restorative care. Observe your client for the following and report to your supervisor: any increase or decrease in abilities, any change in attitude or motivation, positive or negative, any decline in ability, any change in general health, including changes in skin condition, appetite, energy level, or general appearance, signs of depression or mood changes. When assisting with rehabilitation or restorative care, there are attitudes that you can adopt that will be critical to your client's progress. Patience. Progress may be slow, and it will seem slower to you and your client if you're impatient. Your clients must do as much for themselves as they can, regardless of how long it takes or how poorly they're able to do it. This means that although you could do it faster or better, you must encourage them to perform as much self-care as possible. The more patient you are, the easier you'll make it for them to regain their abilities and confidence. Positive attitude. Your attitude can set the tone in the home. Family members as well as clients will take cues from you as to how they should behave. If you are encouraging and positive, you'll help to create an atmosphere that supports and motivates the client in rehabilitation. In addition, your expectations and reactions can contribute to rehabilitation efforts. Keep the following tips in mind to help you have a positive effect on the client's rehabilitation. Focus on small tasks and small accomplishments. For example, dressing themselves may seem like an overwhelming task to some clients. If you break the task down into smaller steps, clients will be able to develop a sense of accomplishment sooner. When the client is able to do the task without assistance, congratulate him or her on this accomplishment. Take everything one step at a time. Recognize that setbacks occur. Progress occurs at different rates, and sometimes a client can do something one day that he or she cannot do the next. Downplay these setbacks so the clients don't become discouraged. Reassure clients that setbacks are normal. However, do document in your notes any decline in a client's abilities that occurs. Be sensitive to the client's needs. Some clients may need more encouragement than others. Some may feel embarrassed by certain kinds of encouragement. Get to know your clients and understand what motivates them. Adapt your encouragement to fit an individual's personality. Guidelines for caring for clients who have fractures or casts. Fractures are broken bones caused by accidents or by osteoporosis, the condition that produces porous and brittle bones that easily crack or break. Osteoporosis occurs more frequently in elder people, particularly women, usually as the result of a loss of calcium from the bones. Some signs and symptoms of a fracture are pain, swelling, bruising, and changes in skin color at the site of the fracture, and also limited movement. When caring for a client who has a cast, follow instructions in the care plan. Keep the following in mind. Elevate the extremity that's in a cast to allow the swelling in the injured tissue around the break to subside. Observe the affected extremity for swelling, skin discoloration, odor, and loss of sensation or feeling cold. Compare to the extremity that does not have a cast. Report any of these observations to a supervisor. Protect the client's skin from the rough edges of the cast. The lining inside the cast can be pulled up and over the edges and secured with tape. Inform your supervisor if cast edges are irritating the client's skin. Keep the cast dry at all times. Wet casts lose their shape. Don't insert or allow the client to insert anything inside the cast, even when the skin itches. It's important to avoid injuring the skin, which can lead to infection. Guidelines for caring for a client who has a hip fracture. Elderly clients are especially susceptible to hip fractures. A sudden fall can result in a fractured hip that takes months to heal. A hip fracture is a serious condition. The elderly heal very slowly and are at risk for secondary illnesses and disabilities. Most fractured hips require surgery. A cast or traction may also be used to immobilize the hip. A client in traction will require special care that will be detailed in his or her care plan. CCAs should never disconnect the traction assembly. Good skin care and repositioning according to the care plan are the foundations of care for all clients who are immobilized. Adapting the environment for people with physical limitations. Many devices are available to assist people who are recovering from or adapting to a physical condition. If your client is having difficulty adapting himself to a task, check with your supervisor for options. Some examples of adaptive devices are specially designed plates, cups and utensils for eating, long-handled shoe horns, bath chairs, and large button telephones. The loss of bowel or bladder control. When people cannot control the muscles of the bowels or bladder, they are said to be incontinent. Incontinence can occur in clients who are confined to bed, ill, elderly, paralyzed, or who have circulatory or nervous system diseases or injuries. Diarrhea can also cause temporary incontinence. Clients who are incontinent need reassurance and understanding. Offer to help them to the bathroom more frequently and keep them clean, dry, and free from odor. They will need good skin care as well. Urine and feces are very irritating to the skin and should be washed off completely by bathing and good perineal care. Clients who've had a disruption in their bowel and bladder routines from illness, injury, or inactivity may need assistance in reestablishing a regular routine and normal function. You can help the client in the following ways. Always be professional and matter-of-fact when handling incontinence or working to reestablish routines. It's hard enough for clients to handle incontinence without having to worry about your reactions. Offer a trip to the commode before beginning long procedures or bathing. Keep a record of the client's bowel and bladder habits. When you can see a pattern of voiding or elimination, you can better predict when the client will need a trip to the bathroom. Encourage the client to drink a sufficient amount of fluids each day. About 30 minutes after fluids are taken, offer to take your client to the bathroom. If a client cannot get out of bed, offer a bedpan or urinal. Encourage the client to eat foods that are high in fiber, as appropriate or assigned. If a client has difficulty urinating once he or she is on the commode or toilet, try running water from the tap or having the client lean forward slightly to put a little pressure on the bladder. Offer positive reinforcement for successes or even attempts to control bladder and bowels. Never show frustration or anger toward clients who are incontinent. The problem is out of their control, and your negative reactions will only make things worse. The benefits of deep breathing exercises. Deep breathing exercises help expand the lungs, clearing them of mucus and preventing infections such as pneumonia. Clients who are paralyzed or who've had abdominal surgery are often instructed to do deep breathing exercises to expand the lungs regularly. If you're instructed to assist a client with breathing exercises, your supervisor or another member of the healthcare team will train you to assist with this procedure. The care plan may include using a deep breathing device called an incentive spirometer or even a balloon for deep breathing exercises. Do not assist with these exercises if you have not been trained. This concludes Chapter 12, and I look forward to being with you later.